Sitting meditation. Make sure that your posture is erect and dignified, aligning the head and the spine in a straight line. Bring yourself fully here. Nothing to do, nowhere to go. This time is for you. Giving yourself permission to completely commit to this 20 minutes for your own well-being. Everything else can wait and will benefit from the devotion you give yourself during this break in the day. Sitting meditation incorporates the mindfulness skills we have been practicing and applies them to observing the breath, not asking you to manipulate the breath in any particular way or to engage in deep breathing for relaxation, but rather just noticing your body's natural breathing rhythm. So go ahead and close your eyes now. We will focus our awareness in the lower abdomen area. Take a moment to notice what the lower abdomen feels like when you breathe in and when you breathe out. You may notice that the abdomen rises on the in-breath and falls on the out-breath. And now bringing your awareness to the sensations associated with the rising of the abdomen on the in-breath and the falling of the abdomen on the out-breath. Just noticing the sensations in your belly, in your rib cage area, in your lungs. Maintain your attention on the natural rhythm of your own breath, the feeling, the rhythmic rising and falling, expanding and contracting. Just as with the other times we've meditated together, if you notice your mind drifting into thought, gently but firmly redirect your attention and awareness back to the sensation of the breath in the lower abdomen. Essentially, we're using the breath to anchor us in the present moment. You may notice that you feel like an observer, witnessing your body functioning and breathing naturally without your conscious participation. And remember to suspend any judgments about yourself. There's no pressure or expectation to do this perfectly. Instead, mindfulness is just taking the time to be, unconditionally accepting yourself. There's no need to label your abilities as good or bad, but rather just bring yourself back to the present moment by refocusing on the breath. Remembering that mindfulness is a skill that is developed with practice. And the more you practice these techniques, the easier it will be for you to stay in the present moment. And just continuing to stay with the sensations of your own breathing. Bringing yourself back, if you've drifted off into thought, back to the sensations of the in-breath and the out-breath in the lower abdomen. Really being intentional about holding your awareness to this location of the body. Again, if you notice that your thoughts are elsewhere, this is completely normal. Simply bring your attention back to the breath, back to the rising and the falling of the lower abdomen. And as you practice this sitting meditation, you may notice that you become aware of other bodily sensations, maybe a sense of discomfort, or feeling the urge to move, or noticing an itch, feeling like you have to scratch. Try to use our mindfulness skills to address these sensations. So find the sensation that's strongest for you right now, whether it's the discomfort or the urge to move. And before you give in to the action of itching or moving, just see if you can allow yourself to dwell with it. See if you can allow yourself to embrace the discomfort, to observe the urge to scratch, to observe the urge to want to move, and just watch that. Just stay with the urge and stay with the discomfort. Just noticing this sensation. And what you may notice after this prolonged attention to the discomfort or the urge is that the sensation most likely changes with time. And there's an important lesson embedded within this experience, which is when you bring present moment awareness to unpleasant feelings or sensations, we are better able to cope because it's a lot easier to deal with the itch in this moment or the pain or discomfort in this moment than the expectation of the pain or discomfort lasting for a prolonged period of time. So just noticing and practicing our ability to observe the discomfort and see how it changes within you just by you observing it. You may also notice that you are able to connect with the hidden observer part of yourself that is able to almost objectively watch and observe the sensations from a higher perspective. So you can observe the unpleasant experiences, the pain, the discomfort, the anxiety, the depression, for the bare sensory experience, apart from the judgment or the evaluations, the expectations, or the irrational beliefs that we commonly attach to these negative experiences. And again, returning our focus to the feeling of the breath in the body, returning our focus to the rising of the abdomen on the in-breath and the falling on the out-breath. And allow yourself to just play with the sensations of the breath in the abdomen, the muscles, the movement of the skin, the feeling of the movement of your rib cage expanding and contracting. Any sensations you might have in the lung or the heart area. Noticing the sensation of the breath in the back of the throat. Do you feel a coolness or a warmness? The feeling of the breath at the tip of the nose as it moves to the back of the throat. Just noticing all of the sensations in your body. In this simple activity of breathing in and breathing out. And just staying with this breath and this one. Nothing to do, nowhere to go. Just practicing moment to moment awareness of the sensations of the breath in the body. Again, when your mind wanders off into thought, this is completely normal. No judgment, just gently bringing ourselves back to the feeling of the next breath. This practicing of returning our focus from a drifting thought to the pure focus of our breath is what helps to train our concentration and focus, strengthening the pathways in our brains to return to focusing. And letting go of judgment as we do. So for the last few minutes, I'm going to suspend the guidance and allow you to have some time in silence, using that time to bring yourself to the focus of the in-breath and the out-breath. Bringing your attention to the rising and the falling of the lower abdomen and experiencing your body's natural breathing rhythm and all of the sensations that accompany this. And now allowing yourself to come back slowly in your own time, maybe wiggling your hands or feet. Coming back to the room, and open your eyes when you're ready.